My name is David Stanley. I'm an orthopedic surgeon here. I do sort of a mix of things. I do a lot of total hips and total knee replacements, but I also do a mix of knee arthroscopy and shoulder arthroscopy and actually a fair bit of trauma. A lot of things in orthopedics can be treated non-operatively, and we usually do start with non-operative treatment. Those are usually fairly low risk. When those fail and surgery becomes either the only option or the best option, then that's when we really start to talk about surgery. I like treating people who I can have probably the greatest impact on their lives. And the typical total joint patient is someone who is sort of falls into that category. These are people who frequently can't sleep at night. They can't do some of the normal daily things that are required as part of living. They have difficulty sometimes interacting socially with their family and friends. And you can take that person who is actually quite debilitated, and by doing a joint replacement can actually reverse almost all of those things in their lives and restore, once again, a great deal of function and quality of life.